Hello again everyone, and welcome to my YouTube video. Today I'm going to be talking about BPD, borderline personality disorder in children and teenagers. My name is Tracey Maxfield. I'm a nurse, author, peer specialist, and stop bullying and mental health advocate and educator. And so the mere mention of the word borderline personality disorder, I think, alarms and also confuses many people. It is one of the most commonly diagnosed mental illnesses amongst young adults and adults. And I think it is also one of the most misunderstood mental illnesses out there. When I was nursing in the healthcare industry, obviously you're going to meet people that have different mental disorders. And I know every time someone would come to the hospital or to the office and one of the diagnoses would be borderline personality disorder, immediately that person was almost stigmatized, and I found it very uncomfortable. Comments made would be along the lines of, oh, you're never going to get anywhere with them, they're very manipulative, they'll play you, they overreact, they'll never be happy. And I thought that used to be quite sad, because almost immediately their plan of care was decided, and it wasn't very good. I've done a lot of research into this disorder in preparation for this video, and also for my accompanying article, which will be on my website, www.traceymaxfield.com. And actually, borderline personality disorder is actually a very stressful and a very challenging disorder for the person who's actually living with it. And so borderline personality disorder used to be called EUPD, emotionally unstable personality disorder, which I think is an even worse term than borderline personality disorder. But it's actually characterized as a complex mental illness where there is a painful mix of emotional turmoil, unstable relationships and self-image, and self-destructive impulsivity. It's been said that those with borderline personality disorder are known to be volatile, can be very difficult with those close to them, and often feel abandoned or betrayed. And this is the difficulty that they have actually forming any ongoing trustful relationships. It is said that living with borderline personality disorder is like being on a roller coaster. And I think you can also say that's true for the person or the parents or the family that are also living with the person. Life is a roller coaster, and it's not all pleasant. So it used to be said that, oh, children and teenagers can't possibly have borderline personality disorder. However, research is now indicating that actually it does occur, especially in children under the age of 18 years old. And the more quickly we're able in diagnosing, assessing, and implementing a treatment plan, actually the more effective it is. So it'll enable them to move into adulthood in better control of their emotions and not so reactive and emotional. Admittedly, trying to diagnose borderline personality disorder in children, especially young children, is a little bit more complicated and needs a skilled psychiatrist, but it is now being recognized and diagnosed much more quickly in teenagers. Now, if you remember from my last YouTube video and blog post on post-traumatic stress disorder and complex post-traumatic stress disorder, the symptoms and signs of complex post-traumatic stress disorder are very similar to borderline personality disorder, as is bipolar disorder. And so that's why it's really essential to get a really thorough assessment and diagnostic tests and cognitive tests and a psychiatric assessment. So I think another thing to further complicate things is that you will find that your child or teenager does not just have borderline personality disorder in isolation. It usually coexists with another mental disorder, such as a major depressive disorder, as I mentioned, bipolar disorder, an anxiety disorder, and it's not uncommon also with eating disorders. So experts actually call borderline personality a biosocial disorder because there is a component which is biological and a component which is social. And the biological component is a highly emotive and reactive temperament, whilst the social factor considers the child or the teenager's environment. So in that we look at, abuse or neglect, or parents that maybe do not respond appropriately to the extreme behaviors and emotions. And what happens if you get that is that the child or teenager does not learn to develop effective skills in recognizing and regulating these emotions, and may start to resort to unhealthy or inappropriate ways of coping with their feelings. And so I think that's why I need to stress that if we can get them early and treat them, the outcome is actually really good. So the specific risk factors which increase the likelihood of a child or a teenager developing a borderline personality disorder include a family history. It's not uncommon that if your parents have it, you're going to have it. A traumatic childhood. So for example, up to 70% of teenagers or young adults with borderline personality disorder experienced severe sexual abuse in childhood. And then ACEs. We go back to ACEs, adverse childhood experiences. Think of traumatic and toxic stress. And that ties in with the biological factor where it's your biology becomes your biography. So in borderline personality disorder, it feels like your brain is on high alert all the time. And so everything is more heightened, everything is more fearful, more reactive, more scary, more stressful. And consequently, your flight, fright, fight is being triggered all the time, on and on and on. Once that is tripped, it hijacks your rational brain and it triggers primitive survival instincts that are inappropriate. And so everything is heightened. If you think of that, everything is heightened, everything is exacerbated, everything is exaggerated. So the specific signs and symptoms of borderline personality disorder, and as I go through them, for an accurate diagnosis, 5 or more of these very specific symptoms must be present before the age of 20 for a diagnosis. So volatile and unstable relationships, which can go from idolizing a person to completely hating and devaluing a person. Emotionally reactive and easily overwhelmed by very intense emotions that just incapacitate them and they can't get a handle on. They engage in self-destructive behaviors. So unsafe sex, risky behaviors, driving fast, drugs, alcohol, smoking. They experience chronic periods of emptiness and worthlessness, and it almost mimics depression. That's why you can have someone with depression but also have a borderline personality disorder. Profound negative self-image, which results in self-harm and suicide ideation. Now, suicide is actually very, very common in teenagers and adults with borderline personality disorder. Other symptoms: explosive anger, which is difficult to control, rapid mood cycling from joy and elation to fear and unrest and irritability. It's like, think roller coaster, okay? Up, down, up, down, up, down. But it's different from bipolar because you don't have the intense long periods of depression and you don't have the mania, the manic stage. An intense fear of abandonment or being left alone. And this can actually be real or just be perceived. Paranoid thinking and dissociative symptoms, and that's where the similarity to complex post-traumatic stress disorder comes in. Now, in children, the signs and symptoms that may indicate borderline personality and I say may because you will require further assessment, are hyperreactive emotions and severe temper outbursts, poor impulse control, and anger and violence, not only towards self, but towards others. And of course, when I'm reading this, for those of you that have been watching my videos and reading the blog posts, memories of conduct disorder come to mind there as well. You can see how all these are so closely related. Other symptoms: significant impaired thinking and reasoning for the age of the child, and a marked disturbance in their relationships with parents, other family members, friends, and siblings. Now, treatment options, very intensive. What we need to do in treatment is to break the patterns of the dysfunctional thinking and feelings and behaviors that cause the emotional distress. And the therapies that are found to be the most successful include talk therapy. So talk therapy is education about borderline personality disorder, awareness of emotions and responses, and how to then integrate them into day-to-day life. Dialectical behavioral therapy, DBD, that teaches coping skills to deal with unhealthy emotions and behaviors. Also how to improve relationships, and it also encourages the practice of mindfulness. Schema therapy. In that, the therapist seeks to uncover and understand schemas, and schemas are unhealthy and unhelpful patterns that a child or a teenager develop if their emotional needs are not met. Other therapy would be social skills training, individual counseling. I think family therapy is imperative. And peer support and group counseling with like-minded individuals going through the same thing could be, but I think the teenager or the child needs to be more advanced in the therapy before they can consider that, because they kind of become codependent on each other. Now, there are no medications officially approved for borderline personality disorder. However, depending on their coexisting mental disorders and also the severity of the symptoms, in some cases, anti-anxiety medications, antidepressants, and mood stabilizing drugs have been found to be helpful. But again, this is dependent on the age, the symptoms, the severity, what else is going on, and also on the psychiatrist. So how can you, as a child, as a teacher, as a parent, as a grandparent, as a sibling, help a child or teenager who is dealing with borderline personality disorder? Because remember, this is a lifetime disorder, but it's teaching them the skills and strategies that they can go on as they face stresses and hurdles in later life. So the first thing is you've got to be patient and be calm. Try to promote a calm home environment. Try not to be resistive and reactive. Try to maintain a daily routine. That's imperative. It provides safety and security. I always stress the holistic approach. So you have to meet all the child's needs: social, spiritual, educational, health. And so diet, exercise, fluids. Also express and encourage compassion, understanding. You've always got to show love and support, whatever happens. And with kids, they always need to be validated and to know that whatever happens, they are always loved and supported by the adult role model in their life. Follow up with medical appointments, follow up with therapy, start implementing what you've learned in therapy and share it with family and friends and siblings, and also with teachers. Go to school, discuss strategies. Another thing is if they have a pre-existing mental disorder, learning disability, cognitive problem, then you have to be alert also to the treatment and management of that, but also to be alert if there's any changes. If they're taking medications, be aware, are they taking them? Is it working? What are the side effects? Other things is to, I think, try to have some one-on-one time, an important time with the child, but don't allow them to become needy or codependent. They have to find their own way in the world, and that's what therapy is going to do. And so you're going to start implementing those skills as well, that they will not be abandoned, that the fear is unnecessary or irrational. And I think another thing is, obviously, we covered it in a previous YouTube video, self-harm. So look at their behaviors, look at the style they're dressing. Are they isolating themselves in their room? Are weapons going missing in the house? Have they suddenly changed their friends? Because kids with borderline personality disorder are more inclined to be risk takers. And so it's not uncommon that they will engage in smoking and marijuana and drugs and alcohol and raves and partying and as I said, the risky behaviors. There is that need all the time to not to be abandoned, to be loved, and so they resort to things to show them that love, which is actually not healthy, and that's the pattern that you have to break. But until that pattern is identified and broken, you need to be aware, are they self-harming? Are they engaging in risky behaviors? Also, are they being bullied? Kids with borderline personality disorder frequently are bullied, but also they become the bully. So I think those are things to be very cognizant of as well. And as you engage with friends and the teachers and the counselor at school, you'll be more alert to that. And then finally, and I think what's imperative, is be aware of the warning signs of suicidal behavior, because as I said earlier, up to 70% of teenagers with borderline personality disorder have made at least one suicide attempt, and 10% of teenagers with borderline personality disorder actually die by suicide. So again, I've covered this in a blog post and in a YouTube video. Be alert for those warning signs of suicide. And again, because of the emotions and the fears of abandonment and the need to be loved and the volatile nature of a kid with borderline personality disorder, it's easy to confuse it with growing pains, going through a stage, hormones. So be very cognizant of that, but also be responsive. If they're saying, you'd be better off without me if I died, you need to follow up on that. Even if they don't have a mental disorder, you really should be talking to them about that, because kids and teenagers say things for a reason. So what is it that has made them say that? Are they hurting? Are they being abused? Are they being bullied? Are they going through something? It could be that they are in the early stages of a borderline personality disorder or another mental disorder, and need help. And so as an adult role model or a parent or a guardian, you need to be alert to those cues. And so I think red flag is suicide and self-harm and risky behaviors, very common in kids with borderline personality disorder. I hope you've got a little better understanding of it. I know it's completely overwhelming, that likelihood your child or teenager, if they have borderline personality disorder, are also going to have another mental disorder. And so I think I need to stress that you need to make time for yourselves as well, and have time out, and maybe join a support group or like-minded people so you can support each other and share stories, but also have time away, because it is all-consuming. It's a tough job bringing up kids, even tougher bringing up teenagers. Now add into the equation a mental disorder, and then add into that a borderline personality disorder with suicidal tendencies. And I can't even imagine how stressed and anxious and overwhelmed a parent or a guardian must feel. So please check out my website, which gives you a little bit more detail about borderline personality disorder. And next week, I'm actually going to be talking about mental illness in Native American Indian and Native Alaskan children and teenagers. November is American Indian Heritage Month, and I'm actually going to be talking about mental illness specifically in that group, in that culture, but I'll also be addressing mental illness and suicide in children and teenagers who belong to indigenous populations. So we'll be reviewing Canada and New Zealand and Australia and what's going on there, and you'd be interested to see there's a very common theme. Anyway, please consider pressing the button below and subscribing to my YouTube channel, and I will see you the next time.